part, okay? It's too much. Right, again, pressure of blood pushing against your blood vessel walls is called blood pressure. That is the very basis of your blood pressure. Okay, now going now to the types of your arteries. You have your elastic arteries, which are your large-sized arteries, your muscular arteries, which are medium-sized, and your resistance arteries, which are small. Now, in terms of your elastic arteries, these are what you call your conducting arteries. Another word I want you to get familiar with, right, when we're talking about the vascular system, is the word conduit. You will actually hear this word a lot, conduit, right? Conduit just means conduction as well, right? Any vessel that conducts substances is called a conduit. So these are actually your conduits. Give me an example of a large-sized artery. Brachial artery, yeah, okay. What was the largest artery of all? The aorta, right? The aorta is the largest artery of all, and it is elastic in nature. It needs to be elastic in nature. Why does it need to be elastic in nature? Very good. Because there's a lot of blood going into the aorta. If it was not elastic, it was less distensible. The blood pressure in your aorta, will it be increased or decreased? It will increase even more. So there's a reason why that your aorta is very, very elastic in nature. But there's a disadvantage to elastic arteries. Okay, just in passing, I'm going to mention this. Elastic arteries are very, very prone to what we call aneurysms. Alright, what's an aneurysm? Okay, an aneurysm is the rupture. Okay, an aneurysm is the rupture of a blood vessel. Right? So please note that the disadvantage of your elastic arteries is because of more distensibility, because of more elastin, they're actually strong, but not strong enough sometimes. And high blood pressures can cause the walls of your aorta to burst, to break, and that is what we call an aneurysm. Where else can an aneurysm happen? Does it only happen in the aorta? Yes or no? No. Where else can it happen? In the brain. Always note that an aneurysm is a medical emergency. So patients have to receive medical intervention as quickly as possible when they have aneurysm. So again, take note, the reason why they call elastic arteries is there's more elastic tissue and smooth muscle. And these are arteries which are very, very prone, okay? These are very, very prone to pressure fluctuations. What do you mean by pressure fluctuations? Take a look at, right, the pressure goes up and down. As in the case of the aorta, right? When there is contraction of the left ventricle, does the pressure in the aorta go up or down? Ah, exactly, right? Remember, you need that pressure to push what open? The aortic valve. You need all of that pressure to push the aortic valve open. That's why I talked about cardiac cycle early, right? Here, because it's relevant to your vascular system. So when it pushes your aortic valve open, is the pressure in the aorta at that time high or low? It's high, right? But as blood goes through the aorta, what happens to the pressure in the aorta? It drops, right? It drops. The drop of that pressure in the aorta will do what? What will it do? I'm sorry, Dr. Okay, well, yeah, the pressure is already increased, but because now the blood has been injected, the pressure in the aorta is now going down. What will happen to the pressure? What will happen after the aortic pressure goes down? Remember, aortic pressure goes up because blood is going through it, but now it's going down. Very good, doctor. Alright? The aortic valve will close shut, and the pressure in your left ventricle will start to go down as well. Right? So that, remember, that pressure fluctuation happens with every heartbeat. So these arteries need to be very resistant to the effects of pressure. For muscular arteries, these are your medium-sized arteries or your distributing arteries. Okay, hello, good evening. Okay, good evening. Okay, now, medium-sized arteries, distributing arteries, what do you mean by that? These are the ones that start to distribute the blood to the other parts of your body. Actually, your brachial artery is a medium-sized artery, alright? It's no longer a large-sized artery. There is still elastic tissue, but in the case of muscular arteries, there is actually more smooth muscle. Why would there be more smooth muscle in muscular arteries? Because it's needed for the letter E. And E is not ecstasy, okay? E is? No, I mean it's needed for an activity. That begins with the letter E. Exercise, alright? It's needed for exercise. Why is it needed for exercise? Remember that as your muscles work, they need more oxygen. They need more blood. So the smooth muscles in your muscular arteries actually facilitate the pushing of blood towards the muscles where it's needed most. If a muscle does not get enough blood, what will it start to produce? Lactic acid. Have you ever experienced this? Do you guys work out? Yes, no? No, you don't? You should start working out, okay? Some of you have non-specific ST segment elevations in your ECG. So I strongly advise you to work out. So when you work out, what happens? Remember, for the first session of your workout, you will actually feel a lot of pain in your muscles. I remember this, when I went wakeboarding in Camarines Sur. Yeah, the first time I ever did that. Okay? The first time I ever went wakeboarding in Camarines Sur. Remember, you're being pulled by a very, very strong rope. Okay? There's a motor that has the rope going round and round, and you're being pulled by it across the lake. Right? It's just like, it's kind of like what? Water skiing, right? Without the boat. Now, because of the pressure that's pulling on it, what do I have to do to remain afloat? My muscles have to also create resistance and pressure so that I remain afloat. Because if I don't, I'll sink. So all of the muscles of my body were working very hard at that time, the first time I ever was wakeboarding. I'll tell you this, after that 1 hour wakeboarding, it was 1 week of hell for me. If I was taking a bath in the bathroom and my soap dropped, it would take me 10 years to get that soap. Right? I was like an old person. Okay? My colleagues were telling me, should we enroll you in a retirement home now? Because I can't even care for myself anymore. What happened to me? Why do I have that type of body pain? Because of the buildup of lactic acid. Remember that my muscles needed a lot of oxygen. But however, the demands of my muscles were greater than what my heart needs to give. You learn biochem, right?